Hello everyone, I am Dr. Sabyasachi Goswami, Consultant General and Laparoscopic Surgeon and a Certified Laser Proctologist. Today I am going to discuss with you regarding piles, also known as hemorrhoids. So what is piles? Piles is a swelling that is found inside or around the anal region containing numerous blood vessels. Now, what are the symptoms a person may face if he is having piles? The main symptom that the patient presents with is passing of blood during passing stool. The blood is usually mixed with stool, and the blood is red in color. It's a bright red in color. And other symptoms that the patient faces are that the swelling is coming out during passing stool, and in most cases, the swelling has to be reduced manually by the patient. Or in some instances, in early cases, the swelling may reduce by itself after passing stool. The patient may also have complaints of itching or soreness or mucus discharge from the anal region. Now, what are the factors that predispose to development of piles in certain individuals? Uh, the development or the occurrence of piles, of course, is totally not clear, but it is seen that certain factors increase the development of the formation of piles. The main factor that is responsible is constipation. So, if a person has constipation and have to spend a lot of time in the toilets and have to strain a lot during passing stool, these individuals are more prone to develop piles. Besides this, there are also certain factors like obesity or overweight or chronic diarrhea. These factors can also, old age, these factors can also lead to the development of piles. Pregnancy is another factor seen in pregnant females that can lead to development of piles. This occurs because of increase in the lower abdominal pressure, resulting in constipation and resulting in the formation of piles. Now, what are the grades of piles? Usually, there are four grades. Grade one pile is when the patient just complains of passing blood with stool, but no swelling comes out through the anal region during passing stool. In grade 2, a swelling comes out during passing stool and it goes inside by itself after the patient has passed his or her stool. In grade 3, a swelling comes out during passing stool and the patient has to put it back inside the anal region manually by herself or himself. And in grade 4, the swelling comes out and it cannot be pushed back inside and it always stays out. Now there is another type of piles which is known as thrombus piles. In this, what happens? The blood clot forms within the piles, leading to severe pain, and patient complains of excruciating pain. If anyone is suffering from this condition, then he or she should consult his nearest doctor as early as possible for further management. Now, what are the treatment options available for piles? The treatment options usually depends on the grade or the type of the piles. For early cases or grade 1 piles, conservative treatment is done, which consists of avoiding constipation, having plenty of fluids or water and high fiber diet to avoid constipation. And if still the patient has constipation, then a laxative is given uh, to get relief from it. Avoiding a sedentary lifestyle, and if you have a job in which you have to sit for long hours, then one should consider about having some form of workout as suitable by him or her, and also avoiding spending too much time on toilet and excessive straining during passing stool. Now, surgery is reserved for advanced piles or piles which cannot be managed by conservative treatment. Surgery can be of three types. One is hemorrhoidectomy, or the conventional surgery for piles, which is done for years by surgeons. It consists of cutting out the piles, and the wound is left to heal by regular dressing. Another type of surgery is stapled hemorrhoidectomy, in which a stapler is used to cut the piles. No cut mark is present outside the body. The third type of treatment for piles is laser hemorrhoidopexy. In this, laser energy used for the treatment of piles, and it is a very minimally invasive procedure. Now, what are the steps that one can take for avoiding development of piles and also to prevent recurrence after surgery? The first and foremost thing one should keep in mind that piles is prevalent in patients who have constipation. So first thing that one has to do is to live a healthy lifestyle, avoid sedentary lifestyle, have plenty of water, have plenty of fluids, have plenty of high fiber diet. And if you are have constipation, then consult your nearest doctor so as to get prescribed some laxative to avoid it. If you are overweight or having a sedentary lifestyle, then consider doing some physical workout as much as tolerated by you. By following the simple steps, one can prevent the recurrence after surgery and also prevent the development of piles in many cases. Hope this small talk was helpful for you. And if you have any further question, you can contact me via my website page or my Facebook page. Thank you all.